There you go. Great. Thank you very much. Hello, everyone. I hope everyone's doing okay. Hold on, start my video. There we go. There I am. Hope everyone's doing okay. I've really enjoyed those that last conversation, those last three panelists and the discussion. I'm going to do my best to add my perspective into these ideas in this conversation that's starting. So I'm not anything by background similar to the three people we saw before. I'm certainly not in the NFL. I am by training a psychological anthropologist, and what that means is that I study the way that culture influences how people think, how people use culture to process information and to make meaning of messages. And I have the real opportunity to the honor to lead an organization called the Frameworks Institute, which studies public thinking about complex social and scientific issues. We've done a lot of work on health, and then studies how the way that we communicate, the way that we frame our messages influences those understandings, the way that people think. And so that in altogether is what's called the science of framing. And I'm going to argue here today with you all that framing and the science of framing is absolutely critical to this question of how we emerge from the pandemic. And so before I get any further, I want to establish a common definition of what framing is. It's one of these terms, one of these words that has become so ubiquitously used that I fear it has lost any and all meaning it ever once had. So a common definition of framing, when we talk about framing, at least for the next 7.5 minutes, what we mean here is the choices that we make in how we present information. Those can be really small, seemingly innocuous decisions. The pronouns that we use, do we talk about us and them, they, those, or do we talk about we? Sometimes the really obvious things, the values that we endorse and choose to advocate for why our issue and addressing it matters so much. So framing is about how all of those choices, both big and small, influence how people think, how they feel, and what they are or not willing to do as a result of hearing our communications. And before I get into kind of my pandemic relevant points, I want to take a step back and just give you an example of framing that I think is relevant to the healthcare field and the healthcare sector. So as an organization, we have done a lot of work over the years on early childhood development, trying to communicate and frame these issues in a way that advances public support for the kinds of policies that support children and families and healthy development. And an issue that we and our partners have struggled with pretty mightily is the issue of child mental health, convincing Americans that young children can have mental health and getting them to be supportive of a set of evidence-based policies that would do a better job of supporting mental health in this country. So we're going to get a little geeky on some data for a second here, but I'll walk you through all of it. So what you see on the screen now is an experiment that we ran about 3 or 4 years ago, in which we tried to see if framing the issue of child mental health, presenting information in different ways about child mental health, could influence people's support for evidence-based policies. And so what you see along the horizontal axis of the screen are the 2 different ways that we chose to frame this issue. So it's an online experiment. It's conducted with about 6,000 different people. And the way that it works is person 1 logs on, they get randomly assigned to read about a child mental health program. And the frame, in this case, we'll say collective progress and prosperity, is the first sentence, is the first line of what they read. And it goes something like, we need to do a better job of addressing child mental health because, and we wouldn't say it in such a cliched way, children are our future, their stable mental health, their positive development is key to our ability to move forward and be successful as a country. Person number 2 logs on, they get randomly assigned to the other frame. They read the same 80 words about the program, except that first sentence, the frame, is different. Instead of collective progress and prosperity, it's about vulnerability. And it would go something like, we need to do a better job in this country of addressing child mental health because children are our most vulnerable citizens, right? They deserve our empathy and our compassion, and we must do better by them. And then there's a third group that gets no message. They're the control group, and they all answer a set of questions that are designed to measure how supportive they are of this set of policies. So what you're going to see on the next click here, what I personally think are 2 absolutely gorgeous green bars are going to appear on the screen. And what those bars are going to show you is the extent to which hearing those different frames, those different ways of positioning the issue, affect people's support for policy. So you'd see two bars and you notice two things. First of all, that collective progress prosperity value is increasing to a statistically significant degree how supportive people are of those policies. That's the good news. We celebrate when we get those findings. But you probably also noticed the second thing, that value of vulnerability is having the opposite effect. It is depressing, it is decreasing people's support for those policies. And the really interesting thing is that in a subsequent analysis where we looked at all the field's communications for a 3-year period, the value of vulnerability was used in over 93% of those communications. So in essence, what the field had been doing, and this happens in a lot of fields, is inadvertently choosing and landing and using a frame that was not only wasting their communications resources, but using them in a way that directly disadvantaged their goals in terms of policy and change. And so I've come to talk about framing using this metaphor of a key. And I think this is really powerful in the current context, that framing has the ability to, the choices that we make and how we present information, to open space for people to think about issues, to see issues in new ways, to have new conversations, to consider and support new solutions. But it also, as we just saw in the vulnerability example, can do the opposite, right? It can close down conversation, it can lead people to reject messages, and it can lead them to turn away from solutions. And so I think framing has always mattered, but I think it matters a whole lot right now. And I've got 3 examples that I'm going to put on the screen that I've been collecting over the last year plus that really show the powerful effect that framing has. And so they go from kind of most obvious to most nuanced. The first one, the initial framing of COVID as being the Chinese virus. There's a lot of research being done and the effects currently being felt of the way that that frame created a palpable fear of other and invoked a strong sense of racism that attached obviously to Asian Americans, but also interestingly to other groups of people. Slightly more nuanced, all of the framing around vulnerability with good intention, however, having a negative framing effect in othering those groups that we are labeling vulnerable and increasing perceptions of stigma of those groups and of stigma felt by members of those groups. And then finally, and I think maybe most provocatively, this discussion about healthcare heroes and the way in which focusing on individual members of the healthcare community and rather than systems powerfully individualizes our perception of responsibility and obscures the social determinants that Representative Miranda talked about in the previous conversation. And so we are, without a doubt, in a period of social upheaval and cultural flux where our fundamental understandings of how the world works that we kind of normally take for granted are being brought up and drawn into focus as we negotiate and contest them. And I think and feel very strongly that framing and how we position our messages is going to be absolutely key in where those issues come down when the dust settles as we emerge from the pandemic. And with that, I will thank all of you and I will hand over to Patricia Turbovich, who's going to speak with you next.